Someday you look closely at your hairline in the mirror. You notice the corner is slowly creeping back day by day. Or maybe your middle part is getting wider and your crown is thinning little by little. And you tell yourself, it's just age. I am getting a little older. You blame daily stress as a real culprit. Or maybe you even throw away your shampoo, convinced that it's the thing that is stealing your hair. But what if I told you something else? What if I told you that for up to half of all men and women, hair loss is written into their DNA, long before the first strand of hair ever falls? And this is the story behind androgenetic alopecia, the most common cause of hair loss in the world. So sit back, relax, and let's discuss the real reality behind male and female pattern hair loss. Hair is one of the few things about our appearance we feel we can control. We can choose the length, the color, the style, and over time they become part of our identity. But what most people don't realize is this. Nearly half of us have very little control over keeping our hair. Genetics, along with a few environmental factors, quietly decide the outcome. And into that confusion, the internet is floods in with myths about hair loss. Some say wearing hats cause it, others blame shampoo, hot water, or stress. You'll hear claims that it is inevitable and untreatable. And on the other end of the spectrum, you will hear promises that one miracle oil can magically reverse everything. But most of those claims are simply wrong. They are either too bad to be true or too good to be true. Hair loss is not a disease of poor hygiene, it isn't caused by shampoo, and it has nothing with cold water, hot water, or wearing hats. These are popular ideas, but they aren't true. Hair loss is a genetically programmed response to hormones, and it more or less affects up to 50% of both men and women by age of 50. This condition is called androgenetic alopecia, which is the medical term for male and female pattern hair loss. And it is a genetically determined condition caused by an excessive sensitivity of hair follicle to androgen hormones, especially a hormone called dihydrotestosterone or DHT. The main male hormone testosterone can be converted into another hormone called DHT in different parts of the body, like in the testes, in the prostate, in the skin, and in the scalp. This DHT is much stronger androgen than testosterone, and it is the main player in the hair loss process. While the amount of DHT around the hair follicles matters, but DHT is not the whole story. What matters even more is how sensitive your hair follicles are to this hormone. And that sensitivity is what determines whether you go bald or not. Many people can develop androgenetic alopecia even when their circulating DHT level are within the normal range. The problem is that their scalp overreacts to DHT. Every tiny signal from this hormone feels like a punch to their hair follicle. Over time, those hair follicles weaken, shrink, and hair slowly sheds away. And the battle between DHT and your hair follicle starts long before you notice any hair falls out, sometimes even back at the start of puberty. And even in the same person, not all hair follicles react the same way to DHT. Hair on the crown and temple may thin very soon, while hair on the back of the head stays strong longer. And this pattern doesn't look the same in everyone. It's different from person to person and varies in male and female. That's why male and female pattern hair loss doesn't happen randomly. It follows a very specific map, with certain area thinning or falling out, while the other stay full. In man, hair loss usually starts at the temple, then slowly move to the frontal hairline, and eventually affect the vertex and sometimes even progress to the back of the head. In women, on the other hand, the pattern is a little different and often misunderstood. The frontal hairline is usually preserved, but hair thins diffusely at the crown and top. The first thing many women notices is a widening center part. Women rarely go completely bald, but this kind of thinning can be emotionally devastating for ladies. After all, hair is an important component of beauty for them. But what really happens deep inside the scalp of men and women who are losing hair? To understand the hair loss, we first need to understand the hair growth cycle. Every hair on your scalp goes through 4 main phases. Anagen is the growth phase when hair is actively growing. Catagen is the transition phase when the hair stops growing and prepares to rest. Telogen is the resting phase when the hair sets quietly in the follicle. And exogen is the shedding phase when the hair finally falls out. Hair loss happens when this cycle is no longer normal, especially when the growth phase is shortened. In normal individuals with no hair loss, about 80 to 90% of their hair is actively growing. In other words, 80 to 90% of their hair is in the anagen phase, which normally lasts about 2 to 6 years, and about 5% is in the catagen phase, and the rest are in telogen phase. Those hairs which are in telogen phase eventually falls out. That's why it is completely normal to lose up to 100 strands of hair every day. It sounds like a lot, but your hair is cycling all the time, and your scalp can handle these 100 strands of hair each day with ease. But for people with androgenetic alopecia, things are very different. The hormone DHT begins to shorten the growth phase. Each new hair that grows is thinner, shorter, and weaker. Over time, some hair becomes so small that they can even reach the surface of the scalp. This slow shrinking of their hair follicles is called follicular miniaturization, and pathology studies reveal that in a healthy scalp the ratio of hair in the growth phase to the resting phase, or in the other word, the anagen to telogen phase ratio, is about 12 to 1. That means for every 13 strands of hair, 12 are actively growing and only 1 is resting. But in the balding scalp, this ratio shifts dramatically. It drops to 12 to 3, meaning for every 13 hairs, instead of just 1, 3 strands of hair are resting. And over time, this creates noticeable thinning and shedding. And the culprit behind it is DHT, not shampoo, hot water, stress, or whatever else. Testosterone gets converted to DHT by a key enzyme called 5-alpha reductase. There are 2 types of this enzyme in the body, type 1 and type 2. Type 1 found mostly in the skin and sebaceous gland, and the type 2 found mostly in hair follicles, the prostate, and genitals. And it is the type 2 that drives male and female pattern hair loss. People with androgenetic alopecia might have higher levels of DHT in the scalp, more 5-alpha reductase enzyme, or more androgen receptor in their hair follicles of balding area. But the most important factor is how sensitive hair follicles are to these hormones. Both the presence of DHT and the follicle sensitivity to it determine whether your hair will shrink and fall or not. That's why some people never go bald. Pre-pubertal children don't develop male pattern hair loss because their testosterone and DHT levels are extremely low. Castrated individuals, if castration happened before puberty, also don't go bald because without the testes, there is no factory to produce testosterone, and without testosterone, there is no DHT. And even more fascinating, people with a medical condition called androgen insensitivity syndrome don't lose scalp hair, even when testosterone and DHT is present, because their hair follicles simply don't respond to testosterone and DHT. In both men and women, it is not just about hormone itself, but the sensitivity of hair follicle to testosterone and DHT play an equally crucial role in male pattern and female pattern hair loss. And you have probably heard another common myth, that baldness comes only from your mother's side, while the truth is much more complicated than that. Androgenetic alopecia is polygenic, which means multiple genes influence whether you go bald or not, and you inherit them from both parents, not just one. Some studies claim that if your father is bald, your risk of going bald increases 5 to 6 times. The prevalence of baldness also varies across different populations. In the US, for example, it is highest among Caucasian, followed by Asian, then by Black population, and the lowest in Native Americans. And these differences come down to the genetic variation again. But regardless of the race, baldness is common overall. By the age of 50, 50% of men experience hair loss. And by 70, that number rises to 80%. In women, the risk of hair loss increases sharply after menopause because levels of primary female hormone estrogen drop with menopause. And this drop changes the hormone balance. As a result, the ratio of male hormone to female hormone increases. This hormonal shift can trigger or accelerate female pattern hair loss, making thinning more noticeable on the crown and the top of the scalp. The diagnosis of androgenic alopecia is usually made clinically. Doctors examine several factors: the pattern of hair loss, the age of onset, and the family history. For men, doctors use the Norwood-Hamilton scale to classify male pattern baldness in different grades. For women, the Ludwig scale is used to track the thinning at the crown and top of the scalp. Doctors also use dermoscopy to see miniaturized hair follicle up close, but sometimes additional blood tests are needed if a doctor suspects another underlying medical condition for hair loss, other than androgenetic alopecia. These might include thyroid function test, iron study, complete blood count or CBC, and in selected cases, syphilis screening. It is important to remember that other medical conditions can occasionally contribute to hair loss. Psychological factors also play a role, and doctor may recommend psychological screening to rule out stress and other mental health conditions. But hair loss and mental health are deeply intertwined. Hair loss can cause depression, and depression can contribute to hair loss. Sometimes it's very difficult to determine which comes first, the hair loss or the depression, because the two often feed off each other. While most cases of androgenetic alopecia is purely cosmetic, there are rare situations where early and severe hair loss can signal deeper health issues. In men, severe early hair loss has been linked to conditions such as hypertension, insulin resistance, diabetes, heart disease, obesity, infertility, and even higher prostate cancer mortality. It's important to note, however, these are occasional occurrences. In women, hair loss can also be a clue to internal health. For example, it may be associated with polycystic ovarian syndrome or PCOS. In this case, thinning hair isn't just cosmetic, it can be a visible marker of underlying hormonal imbalance. But the most common cause of hair loss is again androgenetic alopecia, and there are only two FDA-approved treatment options for it yet: minoxidil and finasteride. Minoxidil comes as topical 5% solution and foam, and it's available over the counter in many countries, which means you do not need a prescription to get it. It works by prolonging the growth phase of each hair, but patience is key. It usually takes 4 to 6 months of continuous use to see noticeable results, and initial shedding is common. Many people stop it because of that initial shedding, while that's a normal thing. But even most important thing to consider is that minoxidil must be used continuously. Stopping it will reverse its effects. We have covered minoxidil in more detail in a separate video on the channel, so you can check that out. Finasteride is an oral pill available in various doses: 5 mg for BPH and 1 mg dose for hair loss. It works by blocking type 2,5-alpha reductase enzyme in the scalp and prostate. Finasteride is most effective at preventing hair loss on the crown rather than restoring the already lost hair. But it helps a little with restoring hair too. Like minoxidil, it requires long-term use, and it is not approved for women of childbearing age because of its potential teratogenic effects. We have also discussed finasteride in detail in another video in the channel, so be sure to check that out as well. Beyond minoxidil and finasteride, there are other therapeutic options for hair loss: dutasteride, spironolactone for women, low laser light therapy or LLT, hair transplant, adjunct therapies like PRP and growth factors. But here is the reality: there are no miracle cure. All of these options are for long-term management, not a quick fix. Hair loss may be visible on the scalp, but its impact runs far deeper than that, affecting confidence, self-image, and sometimes mental health. If you want to dive deeper, check our hair loss playlist. We are building a complete hair care series day by day, covering everything you need to know as a public audience. I will see you here.